the content is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a physician for any questions you may have regarding a medical condition. Hello and Namaste, it's me Partikshya Dhakal.
And it's me, Susmita Poudel.
First of all, I would like to welcome you all to yet another episode of our podcast brought to you by Creative Callosum Nepal. In this program, we will be discussing various diseases that we have encountered during our clinical postings. Without further delay, let's move on to today's case scenario.
A 53 years old male, illiterate, farmer by occupation, permanent resident of Parsa, came to the emergency department of Chiton Medical College and Teaching Hospital on 30th of March at 12:30 p.m. with the chief complaints of swelling in the lower abdominal region for 1 year and pain in the swollen region for 4 hours. According to the patient, he developed swelling in the left groin region, which was gradual in onset with some degree of pain. The pain was relieved by analgesic, but the swelling did not regress with it, and the swelling was reducible type. However, recently 2 days back, he found a sudden increase in the size of swelling, which was more marked during coughing and decreased while lying on spine position. On the same day, he developed severe pain for 4 hours over the area of swelling, which was gradual in onset, sharp breaking in nature, relating to the epigastric region, and the pain was continuous type, associated with 3 episodes of vomiting, which was non-projectile, non-bilious, and containing food particles. There was no history of chronic constipation, straining during defecation, no significant past medical and surgical history, and no family history of condition were found. So, on the basis of history, what may be the diagnosis?
Swelling and pain in the groin region can suggest many possible diagnoses. So, before coming to diagnosis, let's discuss the examination finding of this patient. On examination, the ring occlusion test does not show any impulse after occluding deep ring. The invagination test showed impulse. Jaiman's test also showed impulse. In your opinion, what may be the various conditions suggestive of the history and examination?
So far, to my knowledge, the possible diagnosis may be femoral hernia, direct and indirect inguinal hernia, hydrocele, testicular torsion, groin abscess, and femoral artery aneurysm. During Jaiman's procedure, the impulse was felt on the index finger, which excludes direct inguinal hernia along with femoral hernia. By transillumination, that is, passing light to the scrotal contents in a darkened room, no fluid seen, that excludes hydrocele. So, what do you think?
I think our case is of indirect inguinal hernia, since the swelling protrudes into the scrotum when the patient stands. During the Jaiman's test, impulse was best felt on the index finger, which is more obvious when the patient was upright, is suggestive of indirect inguinal hernia. Since clinical examination is most reliable for indirect inguinal hernia, so investigations in these conditions are of very little significance. So, what are the possible investigations that can be ordered in this case, and why is it important?
Investigations like abdominal ultrasound and CT scan are investigations that can be ordered. In certain cases, these imaging techniques help to rule out abdominal mass and other differential. Moreover, it is of much importance as it helps to rule out intestinal obstruction and infraction, which itself is a medical as well as surgical emergency. So, it is a must to order these investigations. Here, I have the results of abdominal ultrasound, which says outwashing of abdominal wall with intestinal content with no obstruction. Hence, it proves our diagnosis to be hernia. Now, let's discuss about the management of indirect inguinal hernia. It is safe to recommend no active treatment in cases of early asymptomatic particularly in elderly patients population who do not wish for surgical intervention. These patients should be warned to seek early medical care if the hernia increases in size or becomes symptomatic. Elective surgery for inguinal hernia is a common and simple operation. It can be undertaken under local, regional, or general anesthesia with minimal risks, even in high-risk patients. If untreated, indirect inguinal hernia may lead to various complications. Can you name the complications?
If surgically not repaired, it may enlarge. Large hernias can put pressure on surrounding tissues. In male patients, they may extend into the scrotum, causing pain and swelling. When part of the intestine is trapped in the abdominal wall, blood flow to this portion of the intestine may be diminished. This condition is called strangulation, and it may lead to death of the affected bowel tissues. A strangulated hernia is life-threatening and requires immediate surgery. Urinary retention, bleeding, anesthetic-related medium seroma, late chronic pain, and testicular atrophy are the various complications of indirect inguinal hernia. In this episode, we discussed the case of indirect inguinal hernia. Thank you for listening patiently. Do not forget to like, share the video, subscribe the channel, and comment down your valuable suggestions. We will be back with another episode. Till then, have a good time.